Looks like we have a decent amount, so I'll go ahead and get started. So I just kind of wanted to first start off by introducing myself. My name is Kelsey, and I'm an account executive here at Cerbo. I'm so happy you're able to join us today. And if you're like most practices I speak with weekly, you're juggling a lot, delivering exceptional care, managing operations, and somehow trying to carve out time to market your services and grow your patient base. And let's be honest, that often falls to the bottom of a very long to-do list. That's why conversations like the one today are so important. When you have the right tools, strategies in place, growth doesn't have to happen at the expense of your time or your sanity. And at Cerbo, we work with practices that are looking to run more efficiently and grow more strategically. Our fully integrative EHR, practice management, and patient portal platform is built specifically with cash-based practices in mind, giving you the tools to simplify daily operations, reduce repetitive administrative tasks, and free up more time for what matters most, your patients and your growth. With Cerbo, you can streamline everything from scheduling, charting, secure patient messaging, to supplement and lab ordering, billing, and beyond, all in one intuitive system. And today you're going to learn how to take that same approach into your marketing using practical time-saving strategies to attract and retain the right patients and make sure your practice stands out. So with that, I'll go ahead and kind of introduce you to Steven Schwartz from Concierge Medical Marketing. He's our marketing specialist, and I'll let you go ahead and take it away, Steven.
Wonderful. Thank you so much, Kelsey, and to the entire Cerbo team for the opportunity to join on your webinar today and share a few practical, helpful tips on how to use this brand new AI thing that everybody seems to be talking about. How do we take this AI thing and tangibly actually put it to work using techniques and strategies to help us with our marketing or marketing our practices? How do we get our name and face and message about our medical practice out in front of the people who are actively looking for it? So what we're going to do today is we're going to pull all that together. We're going to, in fact, I'll go ahead and jump here. Again, I'm Steve Schwartz with Concierge Medical Marketing. All right, I've got the agenda here. So our goal here today is to use AI to grow, streamline, and simplify your membership practice marketing. This is for concierge practices, DPC practices, any practices that have a membership related pricing model as opposed to a traditional insurance model. Now, what we're going to cover today is specifically, where do most practices go wrong if they try to implement AI into their practice? We're going to cover a whole lot of different ways that AI can be used in these membership membership practices for their marketing, but we're going to do a deep dive into 5 powerful AI marketing strategies that can lead to patient acquisition. And you may be looking at this and saying, I'm not very technical. I don't know too much about this AI stuff. How can you make this easy for me to do or easy for a member of our team to do? And I'm going to show you a tool that we've been working on the last month or so, which will make it so much easier. And if we have a little time, we're going to have a live chat, question and answers. I'll do the best I can, or Kelsey will as well, to answer any questions you may have.
Hey,
All right.
Stephen, before you proceed, we're getting some comments that you're kind of hearing muffled or far away. Is there any way you can adjust some of the settings there?
Good question. I don't know. I'm on the sharing here. More computer sound. Okay, does that sound any better? Does that sound any worse?
I feel like you sound okay to me. Okay. Getting some feedback too that you sound good. Yep, you can proceed.
Okay, good. All right, so moving forward, just very quickly, this presentation will be recorded and it will be made available to you so you can go through these slides at your convenience, all right? Martina says it's the same. I'm not quite sure what to offer here. Give me a second. Chris says I sound great. Martina says it sounds the same. Okay. I'll put up the volume. Carry on. All right, I'm going to do the best I can. I'm going to speak a little bit louder, and hopefully it doesn't sound like I'm yelling at you. All right. Here we go. All right, now, why is marketing broken for many medical practices? There is a lack of consistent brand message. Many times practices implement marketing techniques and items in the wrong order. And for these type of membership practices, especially concierge and DPC, many patients need to first be educated on the value of membership medicine. How is this different than an insurance-based practice? Why is it different? Why should I spend money per month when I already have insurance? So we need to educate people. There's also a lack of marketing automation, systems that are able to help with a lot of the monotonous tasks related to marketing, and time and budget can be very tight. So how can we improve these outcomes? And the answer is AI. It is fast, it's efficient, it's personalized, and it is always on brand if it's used correctly. And we're going to talk about that today. Now, many providers do try to create content with AI without training it properly first. Please don't do that. If you have tried to use ChatGPT or other tools before, if you don't properly train it, the output is not going to be that great. Could you do me a favor here and just in the chat area, can you press #1 if you've used ChatGPT or another AI tool to create content? I'm trying to get an idea of how many people have been actually using it. Excellent. Lots of ones. Very, very good. And let's do this. Next, I'd like you to say, if you think you're an expert at AI and prompts and all this kind of stuff, I want you to write the letter A. And if you're kind of experienced, but you're not, you really want to learn more, put B. And if you don't know anything about any of this, and you're like, I just want to learn how to do this, put C. Okay, we've got a lot of B's and C's, it looks like. I think I've got one A. All right, very good. Thank you for sharing that. That really helps me out to know what we're talking about at what level and all that. Perfect. So when you program or use an AI tool, I'm just going to say like ChatGPT because it's the granddaddy of all of these. If you don't properly train it beforehand, then the output that comes out of it is very generic. It's very bland or boring. It doesn't really have a whole lot of specifics about your practice. And the voice or the tone of your medical practice does not reflect your brand. And this results in a lack of authenticity. People think, this is just kind of fluff. It's not doing much for me. And so, second here, there we go. So what are the things that AI is really good at? Let's talk about that just for a minute. #1, you can use AI to create content. This is for the people who chimed in letter C on the chat a few moments ago. I know that AI is out there. I know it's important. I know it's growing, but what can I really do with these tools? Well, #1, content creation. You can create email sequences, blog posts, and web pages. You can create images. You can create videos, social media posts, and all that. #2, you can use the AI tools to give you increased exposure of your practice on the internet. For example, your Google business profile, which we're going to talk about in depth here in a few minutes. How do we optimize that profile so it gets more exposure? The more exposure it gets, the more leads you get to your practice. We can have it analyze your website for SEO Google ranking. We can use it to take a script of a video that somebody else did and spin it to be a different version of that same video in your practice's voice, saying the same thing, but in your own way, your own practice, your own location and specialties. AI is also very good at responding to reviews. When people leave reviews on Google or on Facebook or other places, health grades and whatnot, it's important that you reply to those reviews, but you have to do it in a compassionate, positive, keyword search friendly way that's also HIPAA compliant. All right. And if you do that wrong, you can get into trouble. So we don't want that. The AI tools can help you do that very easily. And for those who are more techie and you want to use your AI tools to help you create structures on the internet, like websites, landing pages, digital marketing funnels, plan your automations, all that kind of stuff. AI is very good at those things too. So let's dig into 5 specific use cases now. All right, here we go. As I mentioned a few minutes ago, the first AI use case that we're going to get into is the Google Business Profile optimization. Now, sometimes people say, well, what exactly is a Google Business Profile? It's this thing you see on the right-hand side of your screen. When you go to Google as a consumer and you're searching for something, pizza restaurant near me, or car wash, Daytona, or concierge medical practice, or something along those lines, you see how there's a map, and then there's typically 3 businesses that are listed. The 3 businesses we call the Google Map Pack. Sometimes it's called the Google 3-Pack. And the idea there is it's a grouping of 3 businesses, 3 profiles that are through Google, and you want your business, your practice, to appear in those first 3 positions. Why? Because something like 44% of people who are searching on Google for a practice like yours are going to click one of those 3 options. All right, 44%. That's a huge percent, almost 1 out of every 2. So as you can see, if your practice is not listed in this Google Map Pack, you're missing out on a huge potential number of leads. All right, so how do we optimize this Google Business Profile using AI tools? We can use AI. Let me back up before I continue. On the right side of the screen here, this is what it looks like behind the scenes of your Google Business Profile. Before I forget, if you don't already have a Google Business Profile set up for your practice right now, please do so this afternoon. It is so important. It's probably the most important thing you can do to get new leads to your practice. You go to google.com/business and then follow the steps. I've got a whole nother training on how to do this, so I'm not going to get into it now. But assuming you do have a Google Business Profile already established, once you've created it and sign in behind the scenes, this is what it's going to look like. There's a 10 or 12 or so different things that you can update and optimize. Now, how do we use AI to optimize your profile? You can use it to write a compelling business description with lots of keywords relevant to your practice. You can use it to generate weekly posts. The posts are similar to a social media post like you would do on Facebook or LinkedIn or Twitter. You can create frequently asked questions, and you can then also answer those frequently asked questions so that when people come to your profile, they can see the question, they can read the answer, and feel a little bit better and closer to wanting to contact you to set up their meet and greet appointment. You can also use AI to add keyword-rich services. We offer this service and that service and that service. You can use these AI tools to write those service descriptions for what you offer in your practice. And as I mentioned before, it's really important that you can use the AI tools to draft the responses in a HIPAA-compliant fashion to the Google or other reviews that people have left of your practice. All right, here's a couple more examples. You can have about the practice optimized for the concierge-related keywords or DPC, your medical specialties, and your practice location. You can create posts like, what is a meet and greet visit? And again, you can create those products and services. It's very simple. You click Edit Services, you click Add More Services, fill it out using the content that the AI tool gives you. All right, that's the number 1 of the 5 use cases. The second is we can use AI to create trust-building content that converts. What does this word converts mean? It means taking somebody who's out on the internet, maybe they're researching, and they do something that you want them to do, like fill out a form and submit, or call your practice, or interact with your chatbot, something along those lines. That's what a conversion is. So how do we use AI to create this trust building content that converts. All right, so we can use AI to write blog posts, newsletters, educational guides in your voice about your practice and the way that you speak, right? As we talked about before, you can use it to answer common patient questions in that friendly conversational tone. You can share your practitioner's philosophy, your values, your personal approach. Why did I get into this practice? Why did I become a doctor? Why do I have this type of specialized practice that's different than what I've heard about before? You can use the AI tools to craft these messages to help explain it to people before you actually meet them, before your team talks to them on the phone. You can also use it, as I mentioned before, to build content for email sequences and social media posts. How hard is it to come up with ideas for social media? A lot of people are like, I don't know what to write. What do people care about? I'm going to give you a free gift by the end of this presentation to take that problem away for the next 12 months. Okay, I hope you're excited about that. We can also, as I mentioned, create frequently asked questions that reduce those objections and drive more inquiries to your practice. Now, why does this matter? Patients who haven't signed up yet, or potential patients or leads, they often need more education and exposure to your name, your message, and your brand before requesting their meet and greet appointment. You've got to give them plenty of great information that helps them feel good about reaching out to schedule that appointment. Realize that trust is built through repetition, through transparency, and personality. As a consumer, if you're planning on spending a lot of money on a big deal project on your home, or you're thinking about buying a car, or you're thinking about where to send your kid to college, you're going to do your research first before you just say, oh yeah, that college, that'll work, let's reach out to them. I mean, you spend your time doing the research, and potential patients to your practice feel the same way. They're going to research you and lurk a little bit and study a little bit, read those reviews, read your website, read your Facebook posts and your LinkedIn before they reach out in many cases. Now, again, this content does not just attract people, but it converts them to fill out the form. Here are some examples of content that you can create with AI for your practice. An article for your blog, like why I left traditional primary care. An email sequence or message that says how our practice is different than an insurance-based practice. Frequently asked question could be, what happens if I'm traveling and I need urgent care? Maybe for your social media posts, your Facebooks or your Instagram, what are 3 ways that we make care easier for busy professionals, right? Depending on your niche, train the AI on who your perfect patient avatar is and write social media posts that like you're speaking right to them. All right, I had mentioned that I'm going to give you a free gift. Please don't worry about screen capturing this. Don't worry about that. I'm going to give it to you later, make it real easy. But what this is a prompt that you can literally copy out of a document I'm going to share with you and put it into your ChatGPT, and it is going to create for you a 12-month social media calendar specifically for your practice. And just rattling through this quickly, it starts with, you are my senior level marketing assistant for my concierge medical practice in whatever city or state. You know my brand voice. It's warm, professional, and clear. The target audience is adults ages 35 through 65 who are proactive about their health, and they value time, access, and personal attention to their care. This is a big point right here. Before you create any content, please ask me a series of questions one at a time, waiting for my answer, asking for any important clarifying information, and then proceeding to the next question. So you see how we're training the AI tool who you are, about your practice. It's going to ask questions. You will answer them until it feels that it's got enough information to then spit out content that's useful to your practice marketing. And then it's going to come up with a 12-month social calendar, 4 posts a month, a mix of lifestyle, education, trust building, meet the doctor, and some other stuff. Can you see? Give me a 1 in the comments if you can see that having this would really help things out, saving you time, effort, and hassle, okay? Give me a 1 in the comment if you think that would be helpful. Sweet. Seeing lots of ones. Good, good. All right, moving on. There we go. All right, our third of 5 AI use cases is using an AI tool for local SEO and improving Google rankings. Everybody says we want to be at the top of Google, right? Let's talk about how to use AI to help your practice do that. All right, so if you look at the right, this is what we call the organic results. I did a search earlier today so that the data was fresh. See, it's still the Earth Day logo on here. The search is for Austin concierge doctor. And here are the top 3 businesses that came up on that. So these are the top 3 in the organic. This is not pay-per-click Google, okay? Now, we can use AI to write keyword-rich service pages and blog posts. For example, let's say you offer get ready for school physicals for the children in the household. You can have a page created by AI on that topic, written in your voice about your practice, and then you publish it to your website so that when people type in a search for, let's say you're based in Austin, Texas, they can search for, Austin, Texas, school physicals or teen school physicals, something along those lines. That web page has a better chance of ranking because it's designed specifically for the phrase that people are searching for in the area geographically where you're located. Hope that all makes sense. You can optimize your content for your city, concierge doctor, or your city DPC practice, or direct primary care of Springfield, Virginia, wherever it may be. Again, we talked about creating frequently asked questions on phrases that your ideal patients actually search for. There are tools that are available where you can actually see what phrases people are actually searching for on Google right now based on your practice. And then you can create content on your website that answers those questions, okay? You can draft metadata. This is getting techie. Hang on. Things like titles, descriptions, and alt text, and also schema. These are things that your web designer or your digital marketing agency usually deals with to help your website rank higher on Google. The AI tools can help create those, especially if you're trying to do this yourself. Let the tools do the heavy lifting for you. Also, as I mentioned, you can localize your homepage, your about page, your service pages with your city, your area, your neighborhood, your county, your region, your doctors, the whole deal. The more of that you put in there, the better your site will rank when people are searching for those phrases. Hope that makes sense. All right. All right. Now, why does this matter? Between 44 and 75% of patients who are doing searches on Google are going to click on a provider on the first page of Google, right? 44% is the Google free pack or map pack, and another 30 or so percent on those organic listings. So it's super important that you get this right. Local search terms convert much higher than social media posts, okay? These are people who are actively searching for the phrases that you offer about your practice. And understand, if you do this right, SEO or Google ranking traffic is free. It's repeatable. It's high intent. You're not paying per click like you do in pay-per-click Google ads. Once you get good ranking and keep that up, the clicks can continue to come for the foreseeable future. All right, here's some examples of content that you can create specifically for SEO and Google rankings. A blog post, concierge doctor in Dallas, what you need to know. A landing page, preventative care in city and state. An FAQ item, is concierge medicine covered by insurance? Some practices accept insurance, some don't. So make sure that your content, again, reflects your practice. Here's a cool tool that many people don't know about. You can type in reviewmywebsite.com. Obviously, your website address goes in there. And you say, give me advice on improving my organic ranking on Google. You can also do the same by review my Google business profile and tell me what I can do to make it better, more effective, higher ranking. All right. I gave you a little warning a few minutes ago. Here's a heads up. SEO is best handled by an agency who knows what they're doing. Okay. But you're certainly welcome to give it a go yourself. I've talked to many people who say, we've done some SEO ourselves and it's worked out okay. Fantastic. All right. Wonderful. But many times people try it and get frustrated because they don't have a plan. All right. Thank you so much. All right. Looks like I got a lot to cover in 5 more minutes. So moving right along, if you're trying to do this yourself, there's a lot of great information available on YouTube. All right, 5 use cases. Next, ad copy, image, and video creation. You can use your AI tools to create Google ads, headlines, Facebook ads, call to actions. You can create images with different tools. You can create videos, all bunch of different situations, okay? All right, here's an example of ad copy that could be created for a Facebook ad. And you can see it down here. This is an example for a make-believe concierge practice in Las Vegas that focuses on helping men. Last on my list, we have email and text message campaigns. You can use the tools to create email drip campaigns, text message campaigns, and so much more for so many different applications. Here's another example of what it can do. Sorry if I'm going through this a little bit too quickly here. All right. Here are some pitfalls to avoid. Never, ever, never enter any private patient information into any AI tool ever. Please don't do that. Also, the free as well as the $20 ChatGPT Plus take the things you type in and can use that for training the model. So you can also tell it not to do that in the settings. Please be careful not to rely on generic AI output as we talked about. And if you don't have a brand voice, you're forgettable. All right. So we've covered a ton of great stuff that you can use for your marketing. But how do I get started? How do I do this? How do I get everything accomplished? Where do I start? Do I hire an agency? Do I do it myself? What AI tool should I use? I would like to introduce you to Maddy. Maddy is the digital marketing assistant. That's where her name came from. She is a 100% digital tool that I created over the last several weeks specifically to help membership practices like DPC and concierge with their marketing. And I'm super excited to share it with you today. All right, what can she do? Maddy can help with all these things that we've talked about today, like writing blogs and email and text messages, creating ads, updating your Google business profile, building funnels and creating ads and writing video scripts. So many cool things. And again, she is trained on our type of medical practice. All right, how do you access Maddy? Very simple. First of all, you do need a ChatGPT Plus account. It's $20 per month, and it's absolutely worth it. You can use a Mac or a PC. Mobile is available, but not recommended because you're doing a lot of copy and pasting. Why do you need the paid version? So that it can better remember your answers from previous conversations. It's important at the beginning that you train Maddy. She's going to onboard your practice into her system so that she'll give you great content throughout the rest of your dealing with her. She's going to ask about you, your practice, your specialties, your services. Who do you serve? Learning your tone and personality of your practice, what makes you unique, and so much more. And if you're not sure or you don't have these things developed, she will help you create them. Not kidding. She will also give you an initial evaluation of what we call the marketing readiness evaluation. Do you have a website? Is it ready to go? Do you have a value proposition? Do you have a Google business profile? She will help you through this. Then we'll put Maddy to work. You working directly with Maddy, she can create those emails. She can create all this content that we're talking about today. Now, what's included? Unlimited access to Maddy. Your practice data is stored and remembered in your ChatGPT account. It gives you the dynamic marketing roadmap and progress tracking, so it knows what you've done and what's recommended to do next in the sequence. the marketing readiness report, the brand and style guide. If you don't have a brand and style already in your practice, she'll help you create it. And then obviously creating all the content and things that we've talked about so far. You can even ask her, hey, what's new? What should I do next? We also want to make sure that you get the support and assistance that you need to ask questions, or if you find something that's acting squirrely, I want you to be able to ask questions of me and my team. So here's what we've done. We've created the Maddy community. This is a new private group on Facebook that you can join. And by being part of it, you get access to all of this stuff that we have listed on the screen. Access to the most updated version, peer support, idea sharing, the tools and prompts, how-to videos, ask me questions. So many cool things that we're going to offer through this Maddy community. And here's the best part. What is the investment? Everybody always wants you to pay for stuff. Nothing. It's free. It's with my blessings. I want you to join this community. I want you to provide valuable time, effort. Check it out. Help me make this thing as awesome as possible for other people in our industry, so that this whole industry of providing so much better quality medicine to our patients can thrive. At some point, I'm going to charge a monthly fee for access to this Maddy community. But right now, become a founding member, totally free, and there's no ongoing charges. It's going to be free for our founding members forever. If you would like to join the Maddy community on Facebook, scan the QR code that's on the screen, or visit cmmkg.com/just-ask-Maddy. Also, I've written a book, 70-something pages, and this book is available for you for free as a PDF download. It explains not just how to use Maddy, but all the different cool things you can do with her help to market your practice. You can download the book from cmmkg.com/just-ask-Maddy-Cerbo. You can, okay, we're having some issues with no button to join. All right, well, we're going to work this out here. Scan the QR code, you can download the book, and we're going to figure this out. Okay, next, as we wrap up here today, I know I've had to go through things quickly because of the audio hiccup at the beginning. Are there any questions that people have right now? Because this is a good time to go over them as we wrap up. This QR code here will help you access the free 12-month content calendar that we discussed earlier in the presentation. All right? And that is it. That's all we've got to cover today. Kelsey, I want to thank you for helping pull all this together. And again, my name's Steve Schwartz with Concierge Medical Marketing. If you want to get on my calendar for a quick discussion, the link is cmmkg.com/schedule. What I'd like you to do is keep the links that we provided, and I'm going to have to dig into why there's no invite button. Kelsey, if you can provide me with maybe the names or emails or whatever, I'll work with Kelsey, folks, so that we can make sure that you can join the Maddy community successfully without any problems. Because the more people who are part of this, the more people who use it and provide valuable feedback, the more helpful it'll be for everybody to use it to move forward. All right. Lucas had a question about humans versus large language models, question above. All right, I'm looking back for your question. Basically, optimizing content for human search versus LMM search. Yeah, good question. Our goal with the Maddy tool is to create content that people will find interesting to read and that Google will properly rank in its search results, not just in the organic listing, but also the Google Map Pack. One of the training that I'm planning on doing in the future is literally on the topic of how do we make our practice websites rank more favorably when people are searching for it within an AI tool like ChatGPT. So more of that's coming. I know we're kind of run over time here. Are there any other questions that we have that I can answer quickly today? Ron Wilson. One second.
Ron, you're able to speak now.
Ron, are you there? Ron, are you there? I don't see any questions in the chat.
We did
All right.
one from an attendee that was asking the difference between Maddy and ChatGPT. I didn't know if you
Sure.
want to.
Yeah. So very good. So ChatGPT is the AI tool made by OpenAI. And Maddy is what we call a custom GPT. That's a tech geek speak for basically customizing the ChatGPT tool to do a very specific thing or set of things for a very particular specific type of audience. So I created Maddy, the custom GPT within ChatGPT, specifically for medical practitioners in the membership medicine concierge DPC space to specifically help them create content for their marketing, to analyze their websites, to provide so many things that they need in order to succeed in that space without having to hire an agency to do it for you. Does that make sense? Are there any more questions regarding that? Okay. Okay, there's a question from Regina. Once you're approved for the Facebook group, how do we access Maddy? Right, so there is a picture inside of the Maddy community that has a URL to get to it. And actually, let me just pull it up for you. 1 second. One moment. You're going to see some behind the scenes here. Hang on 1 second. Wait for these Zoom panels to disappear. Facebook's coming up. Second. The Maddy community. All right, so this is what the group looks like here. And to access Maddy. So since you're on this call, I'd like you to join the group, obviously, because there's going to be tons of value there. But to get directly to accessing Maddy, go to cmmkg.com/Maddy, and that will take you literally right to it. And you guys still see my screen, correct?
Yep.
Okay, perfect. So as we wrap up here, this is what it looks like when you've done it right. There's a picture of Maddy, your AI for concierge and DPC marketing. And you can click, I'm new here, please help me get started. And that'll start the onboarding process. Once you've been using it for a while, what should I work on next? Can you run the marketing readiness quiz? All right, there's so many cool things that can do to help you use this. And I've designed it to be as user-friendly as possible, trying not to use tech geek speak, language, but very useful, no fluff, get down to business so you can make it happen. Regina, you're most welcome. I'm glad this was helpful to you. Beth, good question. Is there a way to access Maddy without Facebook? Sure. Just go ahead and click the link that I just gave to you, cmmkg.com/Maddy, and you can get right in. It's just the Facebook group is where we can communicate so that if you have suggestions on how to make it better or something didn't work right, I need to hear from you so I can train it better going forward. Okay. Let's see, 2 new messages. Maddy access, thank you. Totally missed how you got the Maddy. Can you explain it? Okay, Kendall, good question. What you're going to want to do, cmmkg.com/Maddy. So that link there will get you directly to the ChatGPT screen where Maddy starts. If you don't already have ChatGPT Plus, the paid for version, please just pay the $20, get it going, and then you can use it to its full potential. Kevin, thank you for your kind words. I appreciate that. Kendall, you're welcome. Are there any final questions? Because I know we're running a little bit long on time here. Folks, was this helpful to you? Can you see how having an AI tool that's customized and created specifically for your type of medical practice can help you do so much with your marketing without having to hire an agency to do it for you? Okay, good. Kendall, Martina, great. Can't find the Facebook group. How do we get there? Okay, so the Facebook group, CMMKG, I think I have it called Just Ask Maddy. Yep, that's it. So I'll put it right here. Just Ask Maddy. Okay, that's Aisling. I hope you got your name right there. Sorry if I didn't. That's the link. And let's see here. Yeah, that should have a button where you can, request to join, but if I don't have that set correctly, I'm going to get it fixed so we can get as many of you folks part of this as you wish. Actually, hang on a second. Member requests. 1 second. Okay, good. So here's different people that have requested to join. Awesome, good. Watch this. Approve all, confirm. That should do the trick of adding everybody who's requested into the group. Cool. What other questions do we have, folks? Any more questions? I know we've gone a bit long here. Yeah, Jen, thank you. Right. Worked for me. Good. Is there anybody that's struggling with getting access to the group or to the Maddy itself? Cannot seem to find the download. Are you talking about the 1 second. The prompt guide? There's my free gift. 1 second. Too many slides, right? Martina says, I need an assistant who can transfer my ideas from my head to Maddy to basically execute. Yeah, Martina, what I'd recommend is use your voice to speak into Maddy. So you're not taking the time to actually type, but instead just click the button so your microphone kicks in, and then that will allow you to talk, and then hit the go button or enter, whatever it is. And that's a much faster way to onboard Maddy to your practice. But one other thing, Martina, is that you can actually have Maddy trained to you when you log in, but you can also have it for an assistant of yours, or your front desk person, or a spouse or a teenager, whatever, to also have access to that information. And Maddy will talk to that person in their voice and their position separately from you and your position, but the content will still be the same. Okay. Okay, Martina, you're talking about after she gives you the output. Yeah, well, I mean, that's part of this, is that you do need to take the content that Maddy generates and then put it where you want to do it. So if you're using WordPress, you can take the content out of Maddy, copy it, paste it, make sure it looks good, and hit the save button to publish a new web page. You can also ask Maddy to format your content a certain way so that it saves you a lot of time when you're copying and pasting it. One other thing is there's a program called Publer that I use, and that's a tool like Hootsuite, whereas you create content, you then put it in that system and push the go button, and it publishes that content to different socials like Facebook and Twitter and LinkedIn and Instagram and all those different places. So that's for social posting and whatnot. But take a look at publer.com as a great tool to at least speed up that. I know we've gone longer than anticipated, folks. I am so glad for the opportunity to share Maddy with you. And please use it, beat it up, try to make it break, because I want to make it better every day, okay? And if you're not part of the Maddy community, please request to join. Let's see. Melissa says the webinar was excellent. Thank you for the content facilitation. I know clinics will find a ton of value in the information. Thank you, Melissa. I appreciate the kind words. Please feel free to share the Maddy community with with your friends and colleagues. The more people we have to use this, the better. And I was thinking about having like the first 100 practices or so would be part of the founding group for free. And at some point, like I said, I'm going to start charging for this. But for now, free access, please use it. Okay. Are there anything final before we wrap this up and say it's been my pleasure being here to share this information with you today. And I wish you guys all the very, very best in your practices. God bless, and keep up the great work that you do elevating healthcare all across our wonderful country. Thanks, everybody, for being here today.
Yeah, thank you so much, Stephen. Super happy to have you on, and I'm sure everyone took away so many little pieces of knowledge because I sure did. But if you guys have any interest in learning more about Cerbo, please feel free to stop by our webpage, cer.bo, and there's a nice little talk to sales button where if you want to get a full demo of Cerbo and see how we can kind of help enhance your practice, please stop by there. Thank you so much again, and thanks for staying overtime with us. But yeah, thanks, Stephen.
My pleasure. Thanks, everybody. Have a great day.
You too. Bye.